Well, let's go back to our earlier story where the Private Health Facilities Association of Ghana say they would readily resort to some drastic actions if the National Health Insurance Authority fails to honor a promise to pay claims owed them. Let's have a conversation with Frank Torblu Richard. He is the General Secretary of the Private Health Facilities Association of Ghana. Richard, thank you so much for joining us. Now, it's almost midday. Have you had any updates whatsoever on the assurance that was given you by the National Health Insurance Authority?
Yeah, thank you very much. And good morning, and good morning to everybody listening to us. As you are aware, we are not supposed to be where we are today. Assurances have come for a very long time, but nothing seems to be happening. So we are still watching our alerts. As soon as we start receiving such alerts, we will back down our demand.
So, as it stands now, no payment has been made whatsoever. That's what you're saying?
Yeah, as I speak to you, we are still monitoring from our various banks. You
Right.
know, we have about 1,000 healthcare service providers on our network. And when issues come like this, until they respond to the call that they have had alert on their accounts, we will not be able to tell whether NHIA has paid or not. So basically, that is the situation at hand.
Okay. And in terms of the debt, how much are you owed?
As I speak to you, we are talking about over 150 million Ghana cedis. That is for all healthcare service providers that are on our network. Now, this value span from some in arrears of 8 months, some 6 months, some 7 months, some 4 months. So the situation we have at hand is not uniform to the extent that anytime they pay, some providers' claims are skipped. For instance, when they are paying all providers for the month of June, some people are not paid, and these people continue to be skipped over and over and over. So we have a backlog of people who have not been paid over a relatively long period of time, and we cannot sit down to allow this to continue again. Basically, like I said, that is where we are where we are.
So how has that impacted the work that the services that you have to offer to the people of Ghana?
My brother, as we speak today, the healthcare service delivery is one of the most important services that Ghanaians would have to enjoy. I am saying this at the backdrop of the fact that when somebody collapses, for instance, as you and I speaking, assuming without any truth in it, that I collapse, somebody must carry me to a healthcare facility and I must be resuscitated immediately. Now, when I am at the hospital, there is no essential services. The facilities are not there to resuscitate me. What happens? Definitely, I'll be gone. So it's actually impacting. That is one side. The second part of the whole game is that we procure drugs and medical consumables from the open market. And when you come to the National Health Insurance list, my brother, we have a situation where you buy drugs at the price of 2 cedis and NHIA is telling you to give it to the client at 1 cedi. You are losing 1 cedi from the beginning of providing service to the people of Ghana. Now, if you multiply that by the number of people you see per month, and then you multiply it for the whole year, you realize that you are always losing money, and yet the money is not coming on a monthly basis. So at the end of the day, you work and give back. Aside that, SNIT is always on our neck, taking most of our members to court. GRA is also there, sending us to court. ECG is disconnecting some of our facilities. And this is the situation we find ourselves. So when you talk of impact, this is the real impact that we are talking about.
So we are hopeful, or we are hoping that the NHIA will stick to its word, and then maybe by close of day today, you see some disbursements being done. But in the long term, what mechanisms or reforms would you propose be put in place in terms of disbursement so that we do not come back to a situation as unfortunate as what we are finding ourselves in now?
NHIA has been established by an Act of Parliament as 650 as amended 852/2012. Okay. Now, the provisions in this particular law is very clear. all we need to do is to have health insurance fund. Okay, the monies that are collected from the health insurance levy must go direct into the health insurance fund instead of passing it through the consolidated fund, going to the Bank of Ghana through controller. I mean, the process is just too long. Sometimes we sympathize with NHIA as an institution because some of us are very much aware about the processes that the money would have to go through before reaching us. So what is the essence of having the health insurance fund? We are advocating or strongly suggesting to the government that, look, when you receive the money, let it go into the health insurance fund, and the health insurance will disburse it from there. It is only when that is done that we'll have a clear way to have a very good healthcare services in this country. Aside that, we're going to have this challenge over and over and over. Despite the fact that the NHIA funds has been uncapped, it will still amount to nothing if the money is not given to the NHIA direct to pay the healthcare service providers, rather than going through the consolidated, the controller and accountant general, the Bank of Ghana before the money coming to us. So basically, I mean, honestly, that is it.
So we should have a health insurance fund dedicated to making these things happen instead of going through the consolidated
fund. It is already there.
Right.
Just that they are not.
They're not paying directly to it.
It is in the act.
Right.
The health insurance fund account is there. So why are they not implementing what is called health insurance fund account? Because when you have health insurance fund account, it makes things very simple, very easy.
Right. Well, so that's Frank Torblu Richard. He is General Secretary of the Private Health Facilities Association of Ghana. Point well made. They are still hopeful that by close of day today, as promised them by the National Health Insurance Authority, they would have their claims paid. But in the long term, he says, let's activate the health insurance fund and make sure that the payments are made directly to the fund instead of going through the process that he has to go through.